social isolation, zero physical activity, disrupted routines. All this has really turned the lives of our children upside down. Stress, grief, anxiety, depression. This is what the children today are facing. To talk about how to deal with the situation, how to cope with the effects of the COVID-19 pandemic, joining us is Dr. Amit Sen. He's a child and adolescent psychiatrist. He's also the director and co-founder of Children First. Thank you so much, Dr. Sen, for joining us and speaking to us on this very, very critical issue, which is mental health. The second wave has brought so much uncertainty. We've seen grief, pain, suffering, and also now there talks about the third wave. So, Dr. Sen, tell us that how can we create an emotionally safe zone for our children in our homes?
Right. So, first thing to understand is that the second wave has been very different from the first. In the first,
Mhm.
um, the COVID was at a distance from most of us. And if we had followed all the regulations of masking and social distancing and hand washing, then we could assume that we were safe. And indeed, most of us were at that time. However, the second wave has actually brought COVID right into our homes. It's broken through all barriers. And I know of people who have isolated themselves for 1.5 years, haven't stepped out, and yet have got the infection. So it is right in our households, and the death and devastation is really telling. And I think young people have seen it from very, very close, and that makes a situation traumatic. And when I say traumatic, it actually jars their inner emotional equilibrium, in a manner which can be deeply damaging and very lasting indeed. Yeah, and those are things we have to be aware of, right? So it's not a passing phase, and it's not going to completely go away the moment COVID goes. And of course, we don't even know when it's going to go away. There's, like you said, the threat of the third wave, which, although I believe is mostly speculation, we don't quite know how it's going to behave. We never knew about the second wave. We don't have much idea about the third. However, it's very important to take stock of what's happening to our children in the here and now, because what was something that we had to be careful about has now become something to be completely, you know um, people are now fearful and paralyzed by the possibilities of what the COVID is doing. And I think all children, all human beings, in fact, in NCR, in India, there must not be a single person who has not got affected through some kind of personal loss or the COVID infection itself. So
Yes, yes.
the anxiety and the fear is the first thing that we have to deal with. And children often react to it in a certain way, or everybody does, from becoming completely frozen and paralyzed by the fear of it, to getting into a situation of panic, to a complete despair. So we have a
Yeah.
range of behaviors and emotions that we often see in children and adolescents at this time. And of course, there is this other added factor of the lockdown and what that has done. The
Mm.
deprivation of all these things that were essential for their well-being, for their growth and development, that has got taken away. And the second wave, the other thing that is it's done is that the moment we started developing some kind of hope, just as we were
Mm.
lifting our heads,
Yes.
it came and hit us
Yeah.
again.
Children
It
actually
took
thought
everything
school
away.
will children actually thought school will reopen, the books were bought, and the new session, they were excited for it. But yeah, the hope somewhere has gone.
We were
In
so
fact,
excited. Hmm.
in fact, I wanted to ask you, like you were saying, you're seeing these kind of things. What are those symptoms which parents should look out to actually understand that their children are going through some stress, or they are, their mental well-being is a little disturbed?
So see, the first thing that gets disturbed are the natural rhythms, like sleep goes all right. A lot of
Mm,
the kids are now sleeping at 2 o'clock, sometimes 4 or 5 in the morning, right? And
mm,
a lot of them can't help it because the kind of disturbing thoughts they have, the dreams and nightmares they're getting, and so on. And of course, a lot of the peer group activity, particularly in the teenagers, are there at night. Then the appetite goes, and then they're demanding junk food all the time. Then you begin to see the mood swings. You can see that they're kind of on the edge, or they're having massive meltdowns, etc., doors slamming, shouting matches, etc., that start happening. The defiance, the oppositional behaviors then creep in,
mm,
and of course, the older ones then begin to look at other avenues of some kind of relief. So they might be using substances, or some of the older ones perhaps alcohol, and screen becomes a big getaway. Then screen addiction then becomes a huge problem, right? And the younger ones, on the other hand, can often complain about physical symptoms, like they might say, complain about stomach ache, feeling nauseous in the morning, feeling lethargic, not being able to get up from bed to attend online classes. All
mm,
these are indicators, and when they add up together, and you find that your child is getting affected in all these different dimensions of mood, of behavior, of natural rhythms, relationships breaking down, withdrawing from their friends and saying, I don't want to be a part of this anymore. That's the time to begin to worry and look at it closely and see what is indeed happening in their inner world. So many times children, are not able to express themselves because they don't have the language,
Yes.
or perhaps they can't identify some of the feelings, or sometimes
Mhm.
feel that they might not be heard, they might not be listened to, or ridiculed even, for what they're feeling at that
Mhm.
time, and they withdraw. So there are these various things that keep children from sharing what they're going through. And it's vital that they do. They have to have a safe space to be able to share what they're going through and to be able to feel held by the elders in the family, by their parents and other people.
So I think as parents, we really need to look out कि what are the symptoms, क्या वो चीजें हैं जो हमारे बच्चे अलग कर रहे हैं, are they withdrawing from their friends? लेकिन आपने खुद ही बोला जैसे डॉक्टर सेन ये एक स्क्रीन, आई थिंक एज अ मदर एज पेरेंट्स वी ऑल्सो वरी ऑनलाइन क्लासेस हो रहे हैं, बच्चे गेमिंग भी ज्यादा कर रहे हैं, सोशल मीडिया पे भी अब आ गए हैं क्योंकि टाइम कैसे पास करें, अब जैसे पहले के जैसे बाहर नहीं जा रहे हैं, तो स्क्रीन का ये जो चैलेंज है मोस्ट ऑफ द पेरेंट्स आर फेसिंग, इसके लिए कुछ क्या किया जा सकता है, क्योंकि आप बच्चों को मना भी नहीं कर सकते, देन दे आर हैविंग मूड स्विंग्स, द देयर बिहेवियर इज चेंजिंग, सो कैन यू गिव अस समथिंग फॉर दैट, उसके लिए कुछ बताइए प्लीज.
Yes, yes. So see, again, imposing rules and boundaries from the top is not going to work, especially with the older ones. Yeah. And they're going to rebel big time because already they're very anguished. They're, upset, frustrated, hurt, fearful. So they will react to that, right? So the best thing to do is to actually sit down with your young person and reflect and talk about what kind of screen they're doing. Now, screen is essential these days because, like you said, education is on screen, recreation, all of recreation is on screen, social contact, social connect is through stream. So you can't get away from it, isn't it? Because what's left if you take away all those three things, right? So you have to sit down and break it down and say that, okay, let's look at what you are doing when, right? And how many hours of screen are you doing totally? What are you devoting to in terms of, education, academics, perhaps other aspects of academics that you're
Yes, yes.
doing? How many times are you actually in a social space? What are the entertainments that you're seeking from it, and so on? So breaking it down helps, and it also makes the young person aware of how much they're doing, right? And to keep a daily log. So at the end of the day, you don't have to question it. You don't have to, you know, come down with judgment on it, but help your young person to reflect as to how many hours they're doing and what are they distributing it, and then ask. And do you think this is okay? Do you think that many hours of screen is okay for you? Because there is evidence that if you do too much of screen, your attention
Yes.
span shortens, you become more moody, your social skills deteriorate. Are you okay with that? So just pose a question out there, and they might be able to then reflect on that and think through it, and then say, yeah, maybe I need to reduce this or reduce that, and then help them, gently support them to do that. So again, it has to be a collaborative decision. That's the important thing. And when you take a decision for your young person to come off the screen, the question is, what do they do instead? Right? So they can't go out for to play football, or go out for their favorite cafe with their friends. They can't do that anymore. So what can they do at home? That's the other thing that you have to think through creatively, where what the substitute is, if not completely exciting, at least has some value for them in terms of meaning, pleasure, enjoyment. And that's something that you have to look at different motives at home. Maybe there are old videos, maybe there are old books that you used to read together. Maybe there are board games that you need to pull out from from your cupboards, or take old pictures and tell stories about how things used to be, because that also gives a lot of meaning, and it's retelling the story of their lives, because the future is so bleak and there's so much of hopelessness that you can't anchor yourself to the future anymore. So where do you anchor yourself? You can anchor yourself to some of the things that are present at
Memories.
home. Memories, and rich
Yes.
memories, and retelling of those stories actually makes you feel together again. It gives you a sense of identity, which has got taken away. You see, a large part of growing up for young people, the adolescents particularly, is about connecting with peer groups, belongingness, activities that they do, that gives them a sense of self, doesn't it? Yeah. And if that gets taken away, how do you rebuild that again?
Yeah.
That's the question, isn't it?
I think you put it so beautifully, because many times as parents, we just tend to say enough screen time, shut your computer, but we're not giving them an option. I think so. That's really important that we look at how we can spend time with them. How can we give them that emotional security? Doctor said another thing which we've seen is obviously the second wave. It's been tough. I mean, lots death in the family. As parents, as elders, how can we help the youngsters, these children, because they've seen death so closely. It's ambulances, the sirens, oxygen, the whole scramble. So how can we really help them cope with this? The emotional strength, how do we give them to deal with the grief of the loss of someone?
See, again, there are two aspects to this. One is, of course, if a child has lost somebody who's really close,
Mm.
like there are some children who have lost their parents or grandparents,
Yes.
or maybe an uncle or an aunt who were very dear to them. And that's a
Mm.
very, very deep personal loss. And in these circumstances where it's so abrupt, and sometimes the aftermath of the death is so ugly and so jarring because of, you can't go to the funerals, you can't come together as a
Yes.
family. There are
There's no closure. There's no
there's no
closure.
closure, and in fact I know of kids who have lost one parent, and the other parent is in isolation because they also have COVID. So who do the children turn to? And there can't be any other people coming into the house because it's a COVID household. So they're completely isolated, fending for, for themselves, their siblings, and all that. So at that point in time, of course, talking to them about death and announcing it is a big thing. And how do we do it? The language that we use, the kind of safe space that you create for them to help
Mm.
them express their feelings when you announce it. And when you announce it, to have a degree of composure and stability. So again, sometimes if one parent is gone, the other parent might find it very hard to do that. And we sometimes have suggested to other important family members to step in and support the other parent to be able to convey that to the child. But it's important to be honest. It's important to
Mm.
make it clear to the child that this is a very definitive event, that there is no half measures. Nobody's going to come back. They haven't gone to Nani's or Dadi's place and they'll come back after some time. That's not going to happen. And it's important to state it as gently, as calmly, with respect, but yet categorically, right? And then, of course, also talk about what will we do as a family, or what will we do as adults to make sure that their life doesn't get disrupted in a big way. So if the other parent had a parent who's gone had certain roles, who will fulfill that? So the one parent can step in and say, I'm going to look after this, or Nani will come in and stay with you for some time, or your life will make sure that your life doesn't get disrupted completely. And of course, the process of grieving again has to be visited by, and there are of course many ways that culturally people take to, I mean, uh, there are people who might say that your parent has become a star, has gone to God, etc. Other parents nowadays talk
Yes.
about nature and the changing seasons, that things are never permanent and they'll come and go. But
Yeah.
your mother or your father will always be a part of you. You'll carry them, in your mind, in your
Mm.
body, and you'll be able to, have conversations with them, even if they're not physically present, and so on. So there
Yes.
are many ways of actually helping them to hold on to the memories and the good times they've had together, so that
Yeah.
it's not something that they fear. It's not something that becomes something, of course it is painful, it's extremely painful for any child to lose their parent abruptly at such tender ages.
Yes.
But there are ways to deal with it which are better than becoming completely frazzled and breaking down as a system. So when a child sees that everything is breaking down around them, the trauma of that is much greater. But if there is a
Greater.
degree
Yeah.
of control, and if there is a sense that, yes, it is very sad, I mean, we are heartbroken, but we know what to do and we'll be there by your side to help you through this. That makes a lot of difference to a child when they have very personal losses, right? On the
Yeah.
other hand, there are other kids who are, maybe their losses are not of people who are their immediate family, but yet they have close friends who have lost a parent. They might have a teacher who's gone,
Yeah.
and
So
it's important again for the community to come together, right? And also for the family to make sure that the talk of COVID and death and devastation is not there all the time. So even if you don't talk about it, actively, you carry
mm,
that anxiety, don't you? And parents need to be
yes.
aware of what they're carrying, or what they're talking about, or messaging, or so many times children are playing and they're doing their own thing, but if you're on the phone talking about all this to a friend or a extended family member, they're listening in.
They're listening. Yes. They're listening for
Absolutely,
sure. Yeah.
absolutely. And it's important to be mindful of that, to make sure that you create spaces where you do not talk about the devastation all the time. And indeed,
Yes.
I often recommend, and this is again collective knowledge and wisdom we've gathered from families and children
Mm.
that we work with, that it's important, it's often useful to take what I call COVID worry breaks. So you designate a time, two, 3 times in a day, where you sit together, sometimes together. If the child is older, they might do it on their own for some time. Give it half an hour, 45 minutes, take stock of the situation. Like what many of us might do. We wake up, look at our phone, look at the news, and see what's happening. What is the What are the numbers
Mhm.
today? What's happening to the vaccination?
Yes.
Has somebody got affected? Does a friend need support? And you take
Yeah.
stock of all that. And the thing to do is to close it after that. Give that time and say, okay, now it's over. The next time I can worry about COVID is at 2 o'clock in the afternoon or 6 o'clock in the evening.
So that break is there, and you're not
That
just
break is there.
lingering on that feeling, or yeah, yeah. So
Yeah,
that.
yeah, yeah. And that closure is important. Each time that closure and saying that if it crops up, if there is a new message that comes, if there's a new news that, I'm suddenly, you're struck by something, then of course, if it's something really, really upsetting and jarring, you can't help it. But if it is something that you can hold on to, say that I'm going to think about it later, or I'll take it up with the rest of the family at 6 o'clock. I'll tell them as to what's happening around, right? And
Yes,
and
yes.
and again, if one of those breaks is a family time break, where you break it down for younger children even to understand, that's also
Mm.
also often useful. Yeah.
So it's very important as elderly, as as parents, we need to know how to deal with the situation and help kids cope with it. Just a last question in brief, I would like to ask you. India's anyway, mental health is something we barely speak about, and of course, because of COVID, we've started the conversation has started. But for children, we've really never spoken about it, and now what we are seeing. But it's high time it comes out of the closet and we talk about this. It's important.
Oh, absolutely. I think child mental health is neglected like how? In any case, mental health, like you said, is neglected. I
Mm.
mean, I
Yeah.
often give the example of the national health budget, which is in any case quite low in our country. Only 0.5% goes to mental health. Can you
That's
imagine?
yeah.
All of mental health, and out of which a minuscule amount goes to child mental health, if at all, right? So child mental health is often looked after by schools, by NGOs. There are very good laws and policies in our country, but there's hardly anything on the ground to be able to implement any of that, right? So it's a
Mhm.
and that is why you can see the reflection of that in the way we've dealt with children during the COVID situation. See, when the first wave came and things started opening up, everything opened up, right? The businesses opened
At
up,
schools.
the entertainment, gyms, restaurants, holidays. Schools didn't open. I mean, how come? I mean, why didn't anybody think about the impact uh, of the lockdown and not going to school, not having those spaces where children thrive? What's going to happen to their mental health? What's going to happen to their development? Because these
Mm.
are important, rites
Point.
of passage that they have to go through. I mean,
Yes.
passing out from school or going from one class to the other, celebrating with friends, birthdays, anniversaries. They make the lives of children and they help them to grow and develop as human beings. What about that? Did anybody give it a thought? Hardly anybody did, isn't it? Yeah, and that's why
Yeah.
the state of affairs is the way that they are, isn't it? And it's high time that we did it, because if we do not, then this generation is probably going to get scarred by events like this. And if they carry our future, if they are the ones who are going to shape it, then they have to have the mental health, the bandwidth, the creativity and
To
flexibility
deal.
that you need. Yeah, feel safe to be able to take chances so that they can change our world. It desperately needs to change.
I think that's really well put. I mean, it is definitely really important. We do need to think of our children. They are our future, and mental health, mental well being. I mean, that's equally, in fact, it's more important, I think, than physical health. Thank you so much, Dr. Sen, for joining us and sharing this with us. And I hope, this message really reaches out to the parents, and how, as parents, we can help our children cope better, deal with this pandemic. Thank you so much for joining us.
Thank you very much, Ambika, for inviting me. Thank you.